for joining us today on this meaningful occasion ahead of Mother's Day. Mothers are often emotional and physical backbone of the families, actually not often but always. Yet when it comes to health, they are the ones which the last to prioritize themselves. Through today's initiative, we want to encourage every woman, every mother, and every family to understand and care for their own health. And it is not an optional, it is essential, and it is non-negotiable. Cancer prevention is not about one single action. It's actually 5. So it's a combination of lifestyle, environment, vaccination, screening, and early detection. The encouraging reality is that many cancers are preventable and others can be detected early, it can be curable, and of course preventable. So let's go to our panel of experts today. Let me ask the first question to Dr. Shreya Bhattacharya, our head neck surgeon. Shreya, tell us about that. How do you think, what is the importance of early detection?
Yeah, so ma'am, presently in 2026, when I come to my specialty, head neck cancer, it's becoming increasingly a public health concern. Just like how diabetes and hypertension, it's longer a stigma, it's an epidemic, if I may say so.
Yeah.
So, oral cancer is largely a preventable disease. Oral cancer is the ideal model for early detection and screening. It is an easily accessible area. The suspicious lesion is amenable to biopsy. There are certain identified, established high-risk factors like tobacco chewing, tobacco smoking, alcohol consumption, poor oral hygiene, so which can easily be prevented. And we really don't need some very sophisticated instruments like a scope or a very big infrastructure, something which can be done at a ground level with the help of health workers with just a mere, opening your mouth and a torch examination. So I feel there is no other way to overemphasize how important oral screening is. Coming to other head neck cancers like thyroid cancers, laryngeal cancers, again, any change in voice, any difficulty in swallowing, any lump in the neck which has been there for more than 2 weeks warrants an evaluation by an oncologist.
Absolutely. I think, we talked about the first pointer, Sirisha, if I may ask you, is lifestyle. It has a major effect on cancer. So what do you think what is your message about lifestyle today on Mother's Day to all our mothers and women?
First of all, there is in the recent years, we are noting a change in trend in the incidence of cancer cases, especially in the women. And it is mostly related to there is a associationship found in relationship with the lifestyle habits changes. And especially being a gynecologist, I want to notice that especially the cervical cancer, it is majority related to the HPV vaccine, HPV infection. Yes, the longer the HPV infection persists, there is a high risk of development to the cervical cancer, and also the high risk sexual behaviors. And then the tobacco, chewing, the smoking also contributes in a minor extent. But the endometrial cancer, which is showing increased numbers, especially in India, for the past 10 years, there is a rising trend in the endometrial cancer, which is very much associated with the change in lifestyle habits, because it is a hormone related cancer.
Absolutely.
Yes, and that is noted especially in the obesity related, and also in the recent changes in our habits like late marriages, late childbirth, and a reduced number of pregnancies. And because of these habits also, and because of reduced physical exercise, and alcoholism and alcohol intake, and also the smoking, all these are contributing to the change in hormone balance. hormonal balance is again leading to the increased estrogen levels, which is contributing to the endometrial cancer. So everything, again, the root cause is related to the lifestyle. So we need to take care that once after 30 years of age, every woman have to increase the need for the physical activity. Somehow they have to stay active during the day. No need to go to the gym or do the strenuous exercises, but need to be physically aware that we need to be active in given time in a day, every day.
Yeah, I think today's
Yeah.
mothers are also, the olden day mothers used to do so much of physical activity anyway. But today's women, when we are getting into the technology and more into computerization and office work, also there's this lack of exercise that you are actually citing. So, as an example, we should actually ask everyone to be active physically. That's what your message would be.
And also to reduce the oily food and the junk food
Diet.
as less
Diet.
as possible.
One major
Yes,
activity of
yes.
diet. Yeah,
Yeah,
absolutely.
because diet is again showing inflammatory changes, the change in dietary habits is contributing to the chronic inflammation. That is again one of the major risk factors for development of cancers.
Absolutely, absolutely. So, Dr. Jyoti, to you, if I may ask you about, the other, there are a few things which we talked about. One is that lifestyle and focus on lifestyle changes, the right changes. That is one. Of course, early detection. Dr. Shreya has spoken about the early detection, which is
Yes.
one big chunk. Of course, the other two important areas are, of course, vaccination as well as screening.
Yes,
The
screening
importance
and
of screening and both vaccine. Vaccination
Yes.
is, of course, a new topic which can be dealt maybe separately.
Yes.
Maybe you can talk about the screening bit.
Breast cancer is a cancer when detected at stage 1, the early stages. The cure rate is as high as 99%. In stage 2, it goes down to 92%. Stage 3, it drastically goes down to around 75 to 80%. And stage 4 is less than 50%. So, with these data, I can emphasize what is the importance of screening and how important screening is. Breast can now, coming to India, Western countries sees higher incidences of breast cancer, but the death related to breast cancer is higher in India and in Asian countries. Why? Because we lack screening. Now coming to Mother's Day, and if I have to relate this topic, in India we have seen like generations and generations, we look up to mothers as being an image of endless sacrifice. A mother is somebody who would put herself after everyone. So I see patients in my OPD, they know they have a lump in their breast, but they'll come to me after 4 months, after 6 months. What were they doing for those 4 months, 6 months? So one lady, she told me, I was so busy with my office work. I was busy with my child. I was busy with this and that. I thought it's nothing. I asked her, did you miss your child's vaccination? She said no. And I was like, then why are you coming? Like, that surprised me. Like a mother who is at par, she will never miss a tiffin for her child or her husband for one single day.
Absolutely, yeah.
Not her child's vaccination. The child is having fever, she'll run to the doctor that very evening. But what about herself? So I think this Mother's Day, we all should collectively change the narrative of being mother like an image of endless sacrifice, and it should be endless love. And by endless love, I mean love to herself as well, prioritizing herself as well,
Absolutely.
and her health as well.
True.
Yeah.
So well said. Yeah, absolutely. Yeah, and as we'd always talk about, we are talking about prevention and protection ourselves from cancer. Today, specifically, we are talking about not only mother's health, but how do you keep yourself away from cancer. So I go back to the cancer topic and ask, now what do you call about this vaccination? We are hearing this adult vaccination. We are talking about different kind of vaccination to prevent cancers. Is there seriously some vaccination which prevents cancer, Sirisha? Can you?
Yes, ma'am. Cervical cancer is one of the cancers, very limited cancers for which we are having a vaccine against. And cervical cancer is a very important one because it is the second most common cancer in females, especially in women in India.
Absolutely.
And that is majority of the times it is preventable. And for that we have two very powerful weapons, and one is the vaccine and the other is the regular screening methods, and those two are proven to cause 99% defense mechanism against preventing cancer. So coming to the vaccine again, we are having three types of vaccines, and that is Cervavac, Gardasil and Gardasil 9. And Gardasil 9 is the latest vaccine which is FDA and CDC approved as well, and it is against 9 high risk, 7 high risk HPV types and 2 low risk HPV types, the 6 and 11 which are associated with genital warts, but the other 7 high risk HPV types account for around 90% of cervical cancer cases. So it is one of the powerful tool which we have right now, and the ideal age for which the vaccine has to be given is 9 to 14 years of age.
So your message to the mothers?
Yes, my message to all the mothers right now on this Mother's Day is you put all your efforts and you sacrifice a lot for your families, children, parents, and to the careers and building homes. But at the same time, think about your health too. And taking care of her own health is not being selfish. It is like in fact, it's the best gift a mother can give to her family. And for that, please do not um, negotiate with her symptoms, and don't tolerate the symptoms, don't neglect them. So when there is some problem, please immediately consult a doctor.
Absolutely.
Shouldn't be delayed, because right now the biggest challenge as a gynecologist I am facing right now is not that lack of treatment options, it is the delayed diagnosis which is causing the damage right
Absolutely.
now. Yes.
Yeah, so I think that we can sum up the discussions on Shreya, I'll come to you, that how do you think the environment actually overall impacts the cancer prevention? How we can how is the environment and cancer connect? If you can say that, and then maybe your message to today's mother.
So, ma'am, definitely environmental factors, they, especially in the last 10 decades, I would say that they have been very instrumental in all these subsides, especially if I talk about the increased exposure to environmental pollutants, occupational hazards, various viral infections like Shrisha said. HPV is human papilloma virus, and I just want to add, apart from cervical cancer protection, it also provides additional immunity against oropharyngeal cancer. The classic case will be Michael Douglas, who actually suffered from HPV positive oropharyngeal cancer. So that is again an added benefit, and I think very shortly it will be again included in our national immunization schedule as well.
Yeah.
So definitely, and diet, environmental, so just no tobacco, no alcohol or reduced alcohol consumption, sunscreen, sun protection, a healthy diet, protection from environmental pollutants, all this is very important. Again, awareness without action is worthless. And again, I would like to, like what everybody is highlighting, for the mothers per se, when a disease like cancer affects the mother, it doesn't affect the mother alone, it affects the family also. So on this Mother's Day, we all poignantly reflect on the caregiving, the resilience and the gratitude a mother does for his or for her own family. That's what I think.
Absolutely, absolutely. So I think today's, Mother's Day, we will ask all our mothers and all our, future mothers to look after your health in a way that, you stay well, like the way you look after everyone in the family, every, community, friends, we look after everyone, but many a times we do forget to look after ourselves. And my message to all of you would be that take out that 1 hour from your 24 hours for yourself. Not only look after your health, but also look after your physical health, but look after your mental health as well. So do something which makes you happy. Do, whatever, be it singing or painting or spending time with friends. Have a nice simple me time for yourself, and that me time 1 hour is enough for you to keep your mental health well, but at the same time don't neglect any early symptoms which we discussed so far. Happy Mother's Day.